Okay, so you're in that final push before your surgical exams.
Yeah.
And we know how much every minute counts.
Yeah.
So let's jump right into something crucial, surgical nutrition.
Absolutely. It's not just about, you know, making sure patients eat right.
Right.
It's about really understanding their metabolic needs, at every stage.
At every stage, yeah.
From pre-op all the way through recovery, and how that ties directly into, better outcomes.
Better outcomes, yeah.
That's what makes this so important for surgeons.
Okay. Let's start with the basics.
Okay.
Daily energy requirements.
Right.
All of our sources really emphasize this idea of basal metabolic rate.
Yeah.
The energy that your body is just burning just by existing.
Right. At rest.
Yeah.
Just breathing, being alive, keeping your heart going.
It's a lot.
Yeah.
And it's a huge factor in figuring out, the total picture of what a patient needs nutritionally.
Exactly. Just to give you an idea.
Yeah.
A typical 70-kilogram male, that baseline energy expenditure is about 1,800 kilocalories.
Wow.
Just to exist. So, as surgeons, we need to grasp that concept to accurately calculate a patient's, caloric needs.
Right.
Especially, in the context of surgery,
Right,
recovery, all that.
And it's not just about the calories.
Right.
It's about, what kind of fuel.
The type of fuel.
Yeah, exactly. We're giving them. And the source material really emphasizes this key difference
Yes.
in protein requirements
Dude.
between healthy folks and those who are critically ill.
Yeah. So a healthy person needs about 0.15 grams of nitrogen per kilogram of body weight per day.
All right.
But when you're talking about critical illness, that jumps up
It jumps up.
to 0.2 to 0.3
Wow.
grams per kilogram per day. And the reason for that?
Why is that?
Because protein is the fundamental building block for everything.
Right.
Wound healing, tissue repair, immune function.
Oh.
All of those things are dramatically increased after surgery.
Yeah. Yeah. That makes perfect sense.
Yeah.
So knowing how much protein a patient needs
Right.
is one thing.
One piece of the puzzle.
But then there's this whole challenge of how we get it to them.
Yeah. How do we actually deliver it?
Right. And the source material really delves into this debate almost.
Huge topic.
Yeah.
Enteral versus parenteral.
Yeah. So how do we choose? When do we choose one versus the other?
Yeah. So think of it this way.
Okay.
Enteral feeding.
Yeah.
That's our go-to, our preferred route when the GI tract's working.
It's working. Okay.
It's functioning. It's the most physiological approach.
Okay.
And we've got options there, right?
Right.
If they can eat, great. Oral intake.
Yeah.
If not, short term, we can use an NG tube, nasogastric,
Right.
if we need something longer term.
Yeah.
Tube enterostomy. So there's different ways to do it. But
Right.
when the GI tract is compromised,
Compromise. Okay.
now we got to think about parenteral nutrition.
Okay. So that's like, what are some situations where
So many.
the GI tract's compromised?
Yeah, obstruction.
Obstruction.
Could be malabsorption,
Okay.
post-op ileus, any of those things.
Yeah.
Might force us to consider parenteral nutrition.
So that bypasses the gut.
Bypasses.
Completely.
It goes right into the bloodstream.
And the source material gives it's almost an overwhelming list
It is.
of all the situations where that might be needed.
Absolutely. And being familiar with those scenarios.
Right.
Conditions like severe pancreatitis, short bowel syndrome, certain intestinal surgeries, recognizing when it's indicated,
Yeah.
understanding the complexities,
Yeah.
being able to explain it clearly to patients.
Right.
These are all essential skills for any surgeon.
Right. Of course. Of course.
Yeah.
And no intervention comes without risks.
Of course not.
And the source material goes on to talk about all these potential complications.
Sure.
With both enteral and parenteral.
For sure.
So with enteral, you're looking at things related to the tube placement.
Right.
So that's like dislodgement, aspiration, or even fistula formation.
Absolutely.
And then there's always that potential for, diarrhea and just GI intolerance issues.
Always.
Yeah.
Always.
And then on the parenteral side,
Right.
its own set of challenges.
For sure.
I'm thinking about infection,
Yes.
bloodstream infections.
Right. Catheter-related bloodstream infection.
Right.
Big concern.
And then also metabolic complications.
Absolutely. So with the infections, that's just, meticulous care, monitoring,
Yeah.
all that stuff. But metabolically, you can run into, electrolytes getting out of whack,
Yeah.
hyperglycemia, even liver dysfunction.
Yeah.
These are not, trivial complications.
Wow.
Understanding how to prevent them, how to manage them when they happen, vital.
This is a lot to consider.
It is.
For our listeners out there, really hitting the books, getting ready for these exams.
Yeah.
Any final tips on how to approach these surgical nutrition questions?
Focus on understanding the why.
The why.
The why.
No.
Why is protein so crucial in the surgical patient?
Right.
Why would you choose enteral over parenteral or vice versa?
Yeah.
Don't just memorize lists. Understand the principles. Understand the mechanisms.
The mechanisms.
The rationale.
Yes.
That's what's going to help you not just pass an exam,
Right.
but become a better surgeon.
Become a better surgeon.
Yeah.
Well said. I think, it all comes down to using this knowledge
Yeah.
to make good decisions.
Informed decision.
Informed decisions that benefit our patients.
That's
I mean,
the point,
ultimately, their well-being depends on it.
100%.
Yeah, absolutely.